Good evening, guys. Good evening, everyone. Good evening, beta. Good evening. Hope all of you are here. Yeah, so just waiting for you guys to join up. How are you guys, beta? How are you? We are meeting probably after a long time. There was a long gap since we have met last time, either in online or as well as in offline batches, right? Yeah, just waiting for the people to join. Yeah, पानी मार के तोड़ देंगे. चलो कोई बात नहीं. Yes. Good evening. Good evening. Good evening, beta. Let's just allow some 2 minutes time to for all the students to join, and then we will go for the 25 most important biochemistry clinical type questions. Yes. Good evening, beta. Yeah. Good evening to all of you, beta. Good evening. Good evening. Hope you all are fine, and we're almost at the verge of our FMG exam. 6th of July. Not much time is left, and I believe all of you have put your best possible effort. And definitely, my dear friends, it is going to shine up on the day, or D day, whatever you call it as. It is that day for you. It is that day for your moment in life, beta. Definitely, it will be coming out with flying colors on that day. All the questions will come common from biochemistry. Don't worry. It will be from the workbook that we have discussed. However, 25 most clinical type of questions we are trying to focus over here, right? So yeah, I guess all of you are already here. So without wasting much time, let us try to move with the session, right? So क्विकली इस चीज को देख लेते हैं बेटा. फर्स्ट ऑफ ऑल, क्या बात है. ओके ओके ओके. यस, पास होके तो गोवा जाना ही है, वो तो है ही. ओके, सो फर्स्ट क्लिनिकल टाइप ऑफ क्वेश्चन. नाउ ट्राई टू फोकस ऑन द फर्स्ट क्वेश्चन माय डियर फ्रेंड्स. आराम से जाएंगे, एंड होप ऑल ऑफ यू विल बी एबल टू पिक अप विदाउट एनी डिफिकल्टी. बेटा आराम से इस क्वेश्चन को देख लेते हैं बेटा. ट्राई टू जस्ट गिव इट ए गुड क्विक राइटिंग अंडरस्टैंडिंग ऑफ दिस क्वेश्चन. या गुड इवनिंग बेटा, वन मोर टाइम. चलो या सो just give it a time to quickly see this question. We'll be waiting for your ram ram beta, ram 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 ram. Good evening everyone. Yes, so just waiting for you guys to come up with the answer. Yes, yes. Let us try to allow. देखो क्वेश्चंस को पढ़ना है बेका बेटा. रिमेंबर, आई ऑलरेडी टोल्ड यू मल्टीपल टाइम that although hello 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 one more time, good evening, but read the question carefully. read the question carefully बेटा. देखो ऐसे इजी क्वेश्चन आएंगे, ऐसे ही क्वेश्चन आएंगे, बट देयर विल बी सम ट्विस्ट. देयर विल बी सम ट्विस्ट. अभी सही जवाब आ रहा है. नाउ द राइट आंसर इज कमिंग. यस, ध्यान से पढ़ने के लिए बोला है. Do not jump into conclusion fast. That's why I have kept a bouncer in the beginning itself, so that you guys can understand the gravity of the situation, that you don't do a silly mistake beta. On 6th of July, only one thing can go wrong, my dear friends, if you guys go for a silly mistake. सिली मिस्टेक हम लोग नहीं अलाउ करेंगे बेटा. सिली मिस्टेक को हम लोग रोकेंगे. we will read the question properly. We will see whether these are all of the following except type of question or not. Although if all the options are known, but if there is any better answer, no. Now you guys are coming out with the right answer beta. Answer to this question, first of all, without any difficulty, please try to remember, my dear friends, it will be the option number C, that is hypoxanthine guanine phosphoribosyl transferase. I kept a bouncer deliberately. This is not to demotivate you, but just to make you understand that we have to apply our knowledge seriously and sincerely on the exam day, so that we don't go for a mistake. For everyone, try to look for the gender of this patient. It is, please remember, old boy over here, 10-year-old boy brought to the pediatric OPD, mainly with पेन, रेडनेस, स्वेलिंग अराउंड द ग्रेट टो. देखो ग्रेट टो है, दैट्स व्हाई इट इज अ केस ऑफ गाउट. इट इज अ केस ऑफ गाउट. एंड माय डियर फ्रेंड्स, वी ऑल नो दैट इन केस ऑफ there is a disorder called as Lish-Nyhan syndrome. This is actually a case of Lish-Nyhan syndrome beta. LNS, Lish-Nyhan syndrome. Remember, here the uric acid level is elevated, Mother also has been receiving complaint from the school that his son is beating the shit out of everyone. ये जो बच्चा है ये दूसरे का ले रहा है. Please try to understand. Beating up the other students in the classroom. And please remember, we are having extreme hostile behavior over here. There is a hostile behavior, my dear friends. That's we are trying to understand over here. There is a hostile behavior. Try to focus on this, beta ji. Hostile behavior that we have to try to focus. And this extremely hostile male child, actually, my dear friends, will try to go for, my dear friends, for the Lesch-Nyhan syndrome. And usually the clinician will prescribe a drug for the pain management, because you also know there is pain associated with the Lesch-Nyhan syndrome. Please remember, which of the following enzyme deficiency is most likely to cause this? We all know, beta ji, Lesch-Nyhan syndrome, it is due to the complete deficiency. LNS, my dear friends, complete deficiency of the enzyme HGPRT है ना. HGPRT का complete deficiency से होता है this. Try to remember. Yes, self mutilating behavior. Self confident men get heavy sussex. क्या बात है. Yes, all of you are right now, beta ji. This is the option number C, which is correct over here. This is hostile behavior, extremely hostile male child. This is the case of Lesch-Nyhan syndrome, complete deficiency of the enzyme HGPRT. See, although xanthine oxidase can be put as a option over here, like how I have put over here, remember, please pay some time to read the question correctly, otherwise you might make a silly mistake. I really pray to God that on the 6th of July exam, nobody should make any silly mistake, beta. 149 is equal to 0, 150 is equal to 300. This is the harsh reality of this exam, beta ji. That one question, one mark can change your future, my dear friends. So please try to give it a good reading. All the options will be known to you from biochemistry question, but we will not make a silly mistake. Now, just to make you remember, we have already discussed during our sessions that this is actually the classical case of Lesch-Nyhan syndrome, where we have self-mutilation. Just to make you familiarize with all the feature, we have self-confident men get heavy success. See, we have to become like this mnemonic. We ourselves have to become like this mnemonic. Self-confident men get heavy success. Self-confident men get heavy success, right beta ji? So self से हम लोग याद करेंगे most important clinical feature, there is self-mutilating behavior. Self-mutilation है ना, self-mutilation. Yes, we will all pass. Yes, सभी पास करेंगे. Everyone will pass, my dear friends. Self-mutilation. Confident. C से हम लोग याद करेंगे chorioathetosis. And remember, from this letter D, you guys will mark there is chance of dystonia. Chorioathetosis, dystonia. If you ask for a kiss on your cheek, you will get a slap on the other cheek. Remember that story that we have discussed during the class. Men से याद रखेंगे, these children, they are also mentally retarded. E से extremely hostile male child. This is extremely hostile male child. ऐसा काम कोई मेल ही कर सकता है. Please try to understand. Do not go into detail. Guys, please, nothing, no gender bias over here. Extremely hostile male child. That is the point we have to remember, my dear friends. Extremely hostile male child, that you have to focus. And N say, you guys will remember better, nephrolithiasis. There is also higher chance of kidney stones at an early age. Nephrolithiasis याद करेंगे. Nephrolithiasis, kidney stones at an early age. G से, get से हम लोग याद करेंगे gout. Heavy. Sometimes they can only present with hyperuricemia but not gout. Sometimes there might be only hyperuricemia but not a case of gout, beta. And success say, you guys will remember, sometimes they will also show spasticity. So self-confident men get heavy success. Please make a note of this. These are the points to be noted, my dear friends. Self-mutilation, the most important clinical feature over here. This is a hallmark finding. hallmark finding, self mutilation. The others are not hallmark finding, might be shared with or overlapping with other type of disorders. Remember the chorioathetosis, hemibelismus is not seen, it is mainly chorioathetosis over here. Then there might be dystonia, मेंटल रिटार्डेशन, ई से एक्सट्रीमली हॉस्टाइल मेल चाइल्ड, एम से याद करेंगे मेल, एम फॉर मेल, एम फॉर मेल, एम फॉर मेल, एम फॉर मेल, नेफ्रोलिथियासिस, फीमेल चिल्ड्रेन दे डू नॉट प्रेजेंट विद लिशनियर सिंड्रोम बेटा, जी से गाउट, इफ इट इज ओनली यूरिक एसिड एलिवेशन दैट इज हाइपर यूरिसीमिया, एस से याद करेंगे स्पास्टिसिटी, 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 प्लीज रिमेंबर, इंपॉर्टेंट पॉइंट टू बी नोटेड, इसको हम लोग ध्यान देंगे बेटा, विदाउट एनी डिफिकल्टी यू विल ट्राई टू रिमेंबर दिस एंड विल मार्क दिस. रिमेंबर young adolescent presenting with those biting of the nails, chewing of the fingers, sometimes they will be vigorous enough to try to chew up the entire lower lip. ध्यान दीजिए बेटा, इस बच्चे में पूरा का पूरा ये जो लोअर लिप है ये गायब हो चुका है, ये बच्चा अपना खुद का लिया है, प्लीज रिमेंबर, किसी और ने इसका नहीं लिया है, खुद ही खुद का लिया है, बिकॉज हियर द एंटायर लोअर लिप has been beaten off by that particular child itself. Extremely painful, they do experience pain, but there is an uncontrollable urge to destroy the self. खुद ही खुद का डैमेज करता रहता है, प्लीज ट्राई टू अंडरस्टैंड. दे डोंट नीड एन एनिमी, they are their own enemy, my dear friends, please try to understand. That's why ideally we should try to tie their hands and tie their legs. We should not keep these children unattended. They might destroy themselves, they might destroy others, they can start throwing things. Remember, tie the hands, tie the legs, and usually unfortunately in severe cases these children do not survive long enough, my dear friends. Please remember Lesch-Nyhan syndrome, try to understand, important point, please remember. Coming to the second question over here, second question over here, hope there is no confusion. Second question में आते हैं, देखो आराम से आराम से आराम से आराम से. Hello, please, we have to read the question, read it, read it, time will be there, time is enough, but read the question carefully. आराम से सोचोगे, थोड़ा सा ट्रिकी है. do not jump the gun, do not jump the gun, take time answer, take time answer, नहीं तो कैमरे के अंदर घुस के पेलेंगे. take time answer, take time answer, no need to rush, no need to rush, आराम से आराम से आराम से करेंगे, आराम से, no need to rush. Take time, take time, take time, read it, read it, read it, read it. On that exam day I will not be there with you, sitting beside you, it is you who has to manage on your own. You should learn, right? इसको देखो, आंसर करो, इसको देखेंगे, आंसर करेंगे, आराम से क्वेश्चन को टारगेट करेंगे. No need to rush, calm down, take a deep breath. You are facing the real exam. This is the question that has come. We have to go for right answer. How will you choose? How will you choose? How will you choose? दोबारा देखो, दोबारा देखो, दोबारा देखो बेटा, दोबारा देखो. B is not the right answer, B is not the right answer, my dear friends. In this case C is the right answer. Yes, C. In this case the right answer is C बेटा जी. आराम से देखेंगे, आराम से आराम से. First let me mark the right answer over here बेटा जी. Please remember the right answer of this question is this. Right answer of this question is this. कैसे करेंगे diagnosis? How will we do? Try to focus over here, try to focus. 42-year-old male came to you for dyslipidemia, very common thing. This question can come on 6th of July. Dyslipidemia is a very much important problem, my dear friends, in our society. Many people are obese. Obesity is one of the major challenge. Remember, he adds that he is mainly leading a sedentary lifestyle. ये मोटा लोग जो होते हैं ज्यादा काम नहीं करते हैं. And please remember, he also adds that unfortunate event that he has lost his father, remember beta, at the age of 50, also due to ischemic heart disease, most likely MI. Now his LDL is 125 milligram per deciliter. First, let me try to make you remember what are the normal levels of these lipid profile parameters. All of you know, we have studied during our classes, ideally LDL should be lesser than 100. Or at least borderline 100 is acceptable. Some books write it as that it might be also closer till 130. Up to 130 also you may consider this as more or less up to normal, within the acceptable range. Acceptable range. HDL, it is almost in the normal range, 45 mg per dl. Total cholesterol has got high. Total cholesterol, it is significantly high over here. TAG, my dear friend, TAG, my dear friend, it is 350, my dear friends, mg per dl. And they have asked which of the following is the most warning sign in case of assessing the impending matlab chances of ischemic heart disease in this patient. Remember, let me first write the normal things बेटा, normal values. लिपिड प्रोफाइल का नॉर्मल वैल्यूज को एक बार देख लेंगे सबसे पहले बेटा. नॉर्मल वैल्यू एलडीएल से स्टार्ट करते हैं. रिमेंबर इट इज अप टू 130 mg per dl. It is up to 130 mg per dl. First we are trying to target these normal values. HDL, it is actually differing in male and female. Females are actually having little bit higher as compared to males over here. HDL मेल में हम लोग याद करेंगे दिस इज अराउंड 35 to 50. इन केस ऑफ फीमेल इट इज 45 to even up to 60 mg per dl. Normal values you have to remember. Remember, my dear friends, we have the TAG or the triacyl glycerol. Triacyl glycerol, we say it is up to 150 mg per dl. Up to 150 mg per dl. Up to 150 mg per dl. And please remember, we are missing out on one of the important parameter that is called as VLDL, very low density lipoprotein. Please note, it is actually the value of TAG by 5. Whatever you will be the value mentioned for the TAG, if you divide it by 5, अगर हम लोग उसको 5 से divide कर देंगे ना, you will be getting the value of the VLDL or the very low density lipoprotein. Because it is TAG, around 20% of that, around 20% of the TAG basically comes out in the form of VLDL. We have discussed in our classes at MIST during the story that it is the TAG produced in our liver. Some of that will be also allowed to come out of the liver, endogenous TAG in the form of VLDL, and it is usually around 20%. 20% matlab how much we have to divide by 5. Oh, okay. TAG वैल्यू को 5 से डिवाइड करने से VLDL वैल्यू आ जाता है. Remember, and ideally, if your value it is up to 150, we can say VLDL value is possible up to around 30 mg per dl. There was one more guy which was called as IDL or intermediate density lipoprotein. Actually, we do not go for direct estimation of the IDL like that, but we can directly estimate LDL, HDL, TAG, VLDL. और एक पैरामीटर मैं यहां पर लिख रहा हूं बेटा, टोटल कोलेस्टेरॉल. टोटल कोलेस्टेरॉल जिसमें हम लोग ऐड करेंगे LDL को, VLDL को एंड HDL को. याद करेंगे बेटा, total cholesterol you will have to try to add LDL, VLDL and HDL, and try to remember, my dear friends, precursor of LDL is also called as IDL. उसको directly हम लोग estimate नहीं कर सकते हैं because this is just a transition. We don't have that sort of test that can pick up the IDL in the blood. Blood में हम लोग IDL को ऐसे directly नहीं ढूंढ सकते हैं. So why we collect the total cholesterol level beta? Total cholesterol is the summation of LDL, VLDL and HDL. If you just try to add up these things better, if you just try to add up roughly, it is roughly around, remember, up to 200 mg per dl. It is roughly around 200 mg per dl. Roughly around 200 mg per dl. This is the point that we have to watch out over here. 200 इसका values, normal values, all these are normal values that we are writing बेटा जी. One more time, LDL up to 130 मान के चल सकते हैं. HDL vary करता है between male and female. In male it is little bit lower as compared to female. TAG it is up to 150 despite of your gender. Then VLDL, TAG by 5 up to 30 and total cholesterol को मान के चलेंगे it is up to 200 mg per dl over here. Now let us try to understand this. During our classes we have seen that atherosclerosis basically begins when LDL HDL ratio is more than 2. LDL HDL ratio is more than 2. LDL HDL ratio is more than 2, my dear friends, more than 2. जब ज्यादा हो जाता है, more than 2, more than 2, more than 2, isn't it? LDL HDL ratio. Just to make you remember one more additional point that we have discussed, atherosclerosis कब start होता है? atherosclerosis is basically seen when the LDL HDL ratio it is crossing more than 2. Some amount of atherosclerosis will be seen logically. That means in our lipid profile, normally also if you see that 130 over here and HDL, if you just try to see it over here, in case of either male or female, some atherosclerosis is accepted. But that atherosclerosis will be causing ischemic heart disease or not, that will depend on how much you are able to see the higher value. Just above 2, it is not that much alarming. If it is becoming more than 3, more than 4, then it is becoming more alarming. But if you want to just see the ratio of total cholesterol versus HDL, इसको याद करेंगे. Atherosclerosis mainly will become alarming over here. Please remember, it will be increased if the total cholesterol to HDL ratio it is becoming more than 3.5. ध्यान देंगे बेटा इस क्वेश्चन को कि atherosclerosis chances increases if it is going very much high, or if even the total cholesterol, my dear friends, it is becoming total cholesterol to HDL ratio, it is going beyond 3.5 or more, beyond 3.5 or more. And please try to understand in this patient what happens. Actually LDL is not the culprit. Please remember, in this patient ध्यान देंगे, LDL is not the culprit. देखो LDL वैल्यू क्या मेंशन किया है मैंने, 125 है ना, 125 up to 130. I told you can still call it as a normal. Ideally it should be less than 100. It is slightly elevated. Even if you tell me कि सर आपने तो पढ़ाया था 100, चलो 100 भी पकड़ोगे, even if you keep it as an 100, still it is only slightly elevated, not too much elevation, only till 125. HDL, male patient, it is lower normal. HDL is lower normal, 45. Total cholesterol is high. Total cholesterol has gone 240. It is high. Up to 200, it is normal. It is also elevated. But my dear friends, if you just do the ratio of total cholesterol to HDL in this patient, 240 divided by 45, 240 divided by 45, please remember, 240 divided by 45, you will be seeing the ratio is becoming more than 5. And I told you it is alarming when total cholesterol to HDL ratio it is more than 3.5. This is the warning sign, my dear friend. The total cholesterol to HDL ratio is now going haywire. But how the total cholesterol has increased? In this patient, LDL is not the culprit. Hello? In this patient, LDL is not the guy to blame. What is the guy to blame over here? TAG. Oh, okay. In this guy, TAG is the point to be blamed because he is a rice eater. ये पेल के खाता है. Please remember, rice eater. His TAG value it is 350 mg per dl. Ideally, the TAG value should have been up to 150. ये drastically increase हुआ है. For that, you should first know the normal value. 150 से ये jump होके चला गया 350. And I told you TAG divided by 5. It is VLDL. 350 by 5, 70. In this patient, 70 is VLDL, 125 is LDL, and HDL is 45. Just add these three up. In this patient, LDL value आया है 125, VLDL 350 by 5, 70, and HDL is mentioned as 45. तीनों को add करो, the value you will come it as 240. The value will come it as 240. That is what is mentioned over here. So, in this patient, total cholesterol to HDL ratio that has increased significantly, that is not due to the rise of the LDL, rather it is due to the rise of the VLDL. That's why, my dear friends, VLDL type of cholesterol has shoot up too much. Normally रहना चाहिए था up to 30, it has become 70. Drastic increase, and that's why the guy to be blamed over here is TAG. ज़्यादा राइस खाया है, excess carbohydrate diet he has been consuming. That's why VLDL also has shoot up. And please try to understand, this is 240 mg per dl total. The guy, it is not due to 125. It is only LDL, but it is 70 which has become 2 times. That's why the total cholesterol to HDL ratio has go beyond 3.5 and it has now crossed more than 5. This is the most warning sign. Even this statement is true, but this is not the best answer, because in this patient LDL is the guy not to be blamed. ये LDL को blame मत करो हमेशा. Sometime it might be also due to VLDL, because in this patient total cholesterol level is able to rise up because of the VLDL. Please remember, it is the TAG, ट्राइग्लिसराइड ज्यादा हो गया है, जिसके कारण से ऑल ऑफ यू नो दैट स्टोरी, ट्राइग्लिसराइड कैन बी कन्वर्टेड टू VLDL, VLDL to IDL, IDL to LDL. So VLDL is high in the plasma. Now the cholesterol is also being high. That's why total cholesterol to HDL ratio has increased. This is the best possible answer of this question. It is a tricky question, beta. I hope you are able to understand this. One more final time. These are the normal values. These are the normal values that you have to remember. डिसलिपिडीमिया का जो क्वेश्चंस होंगे बेटा, हम लोग उसको ऐसे ही सॉल्व करेंगे. We will try to solve these questions like this. Try to focus, right? Tricky question that might be asked in the upcoming exam. Hope this is crystal clear to all of you and you don't make a mistake in this sort of question. Please try to understand what is the culprit over here. It is the TAG due to which VLDL is high, due to which total cholesterol is high. HDL तो normal है, LDL almost borderline, but it is VLDL which is shooting up. That's why total cholesterol is significantly becoming higher as compared to HDL. Ratio is more than 5. Hope all these are crystal clear to all of you. Please try to focus on this. Now look at this third question. आराम से, मैंने 2 बाउंसर ऑलरेडी डाल दिया है. In the T20 match, in a one day match, we are supposed to bowl only maximum 2 bouncers. 2 bouncers. मैंने 2 बाउंसर डाल दिया है ऑलरेडी. अभी आपको डक नहीं करना है. You don't have to go for ducking. You can try to tackle this ball. Let us try to tackle this ball. आराम से. This is one of the expected question in the upcoming exam. Try to watch out for this. Answer. 2 बाउंसर डाल दिया है ऑलरेडी. नाउ यू कैन गो फॉर रन. अभी मौका है चौका और छक्का मारने का. लेट अस हिट द बॉल आउट ऑफ द पार्क. लेट अस हिट द बॉल आउट ऑफ द पार्क. इसका आंसर 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 आंसर. क्या बात है, क्या बात है. नाउ द राइट आंसर्स आर कमिंग. यस यस यस, वी कैन डू दिस, वी कैन डू दिस. यस, वी विल बी एबल टू पास. Yes, we have studied long story that has been cooked up over here, but the Brahmastra line, what is that line? Remember, urine for methyl malonyl CoA was normal. Urine methyl malonyl CoA is normal, but still you are able to see features of megaloblastic anemia. Answer is not D, my dear friends. In this case the answer will be B9. Yes, C is the right answer. C is the right answer of this question, beta. Urine for methyl malonyl CoA is normal. How can it be B12? I told you the contrasting differential picture between B9 versus B12 deficiency. It is this methyl malonyl CoA. One more final time. Expected question. Methyl malonyl CoA normal. Diagnosis will go for B9 deficiency. Read the last line first. Answer will come from here itself. B9, B12 both can go for megaloblastic anemia. Both can go for macrocytic anemia. Both can go for homocystinuria. How do you differentiate? Methyl malonyl CoA. Methyl malonyl CoA normal. Answer is going for B9. 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 Remember, only in B12 deficiency methyl malonyl CoA can be elevated, right? So this is just the cooking of the story. Sedentary lifestyle ये सब होगा. Lethargy, weakness चलो है. Shortness of breath, ज़्यादा दूर चल नहीं सकता है, होगा ही होगा obviously, because B9 is also important for the RBC growth. It is not able to carry much of the oxygen as well, and everything is okay, but TAG is in the high normal range and high homocysteine level. So this patient is actually presenting with a combined, many things are going wrong. There is hyperlipidemia, there is high homocystinuria, as well as it is mainly due to B9 deficiency. Most common vitamin deficiency in India that can lead to this homocystinuria is B9 deficiency over here, right? इसको हम लोग ऐसे diagnose कर लेंगे. Although we have megaloblastic anemia, but methyl malonyl CoA was normal. Hope all of you can remember this point. important point. Try to focus on this, right? This is crystal clear to all of you बेटा जी. इसको याद कर लेंगे हम लोग. आगे बढ़ते हैं to this question. Don't look at me, look at the question. Don't look at me, look at the question. These are easy. I have already given 2 bouncers for that over. This is easy question. Answer, 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 answer. Answer, 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 right. Yes, yes, yes. We all are right in this question. We all are right in this question. Without any doubt, you guys will go for the answer as zinc. Yes. 7-month-old child. Usually that is the age. Remember, my dear friends, to present with this sort of rashes. These are rashes over genitalia, rashes over the face. This is a classical question for acrodermatitis enteropathica. Acrodermatitis. What is the diagnosis? Hello, what is the diagnosis name? Diagnosis क्या है? What is the diagnosis? Okay, zinc deficiency, ठीक है. But acrodermatitis enteropathica. Yes, my dear friends, please remember, we all know zinc deficiency can also present with diarrhea. That's why the doctor had prescribed ORS and antibiotics as well to treat the infection for the case of diarrhea. And we also know there is a rashes over the genitalia as well as face. And please remember, in the treatment of diarrhea, we all know zinc is one of the brahmastras. Zinc is very much important for the treatment of diarrhea, and actually this is a case of acrodermatitis enteropathica. इस केसेस में हम लोग डायरिया को ट्रीट करने के लिए along with ORS and antibiotic, all of you know ofloxacin, ornidazole, all of those things you can give. ORS has to be given in the treatment of diarrhea, as well as you have to also go for zinc supplementation. Zinc supplementation is very much important, beta. We can also do the diagnosis by looking at these 2 pictures over here, genital rash as well as face rash, facial rashes, malar rashes, right? Important point. This history of diarrhea is also present. Diarrhea, wound healing. Yes, wound healing, wound healing, wound healing, wound healing is also to some extent countered either by vitamin C supplementation or zinc supplementation. However, they have not given the history of wound healing. They might also add one more point, wound healing. Still, the answer will remain as zinc. Vitamin C, scurvy wala story, we have got those wound healing. That time we have gum bleeding, petechial hemorrhages and all those things. That is different. But this is a clear-cut case of acrodermatitis enteropathica, right? Hope this is clear-cut, right, my dear friends, right? Also, yes, in zinc, yes, yes, yes. All of you know, important, yes, okay. सो दीज आर द इंडिकेशंस ऑफ ए जिंक डेफिशिएंसी. बेटा बहुत सारे फीचर्स हो सकते हैं. रिमेंबर द लिस्ट गोज ऑन, द लिस्ट गोज ऑन. बहुत सारे प्रॉब्लम्स हो सकते हैं. आई एम जस्ट हाईलाइटिंग द मोस्ट इंपॉर्टेंट पॉइंट. एज यू गाइज हैव बीन गोइंग फॉर पुअर वुंड हीलिंग, इसको मार्क करेंगे हम लोग. Poor wound healing is important. You should remember ongoing diarrhea. Last 2 is very much important. Remember, beta ji, another important point to be noted that in this sort of patient, we are having few other important that we should mark. Brittle nails. Yes, brittle nails. Brittle, easily fragile nails is a feature of also zinc deficiency. Remember, creaky joints, creaky, crack, crack, creaky joints, creaky joints, creaky joints. Also, it is important to be noticed over here. Also, try to remember that we have multiple features: thyroid profile, your sugar profile, your chances of diabetic complications also will increase. Easy fatigability, excess appetite, excess hunger, these are the features. And please remember, the overall immunological function also will try to decrease down. The list goes on. There will be also thinning of the hair strands. Apart from brittle nail, please remember, it is also thinning of the hair strands. Hair will also try to break easily. These are the features that we have to also important, my dear friends. Try to remember this. And ultimately, it can also have an effect of the CNS, that is poor memory as well as concentration. These are the other features that we have over here. इसको एक बार देख लो बेटा. अगर थोड़ा बहुत कुछ आ गया, याद रह जाएगा, तो हम लोग आंसर करके आ जाएंगे, राइट? प्लीज ट्राई टू अंडरस्टैंड दिस. एंड ऑल्सो रिमेंबर, इन केस ऑफ मेल, swelling of the prostate also causes poor urine flow, due to which it might also lead to erectile dysfunction. Yes, that is rashes. This rashes everybody knows. This rashes everybody knows. But at the same time, remember, in case of male, it has been also seen that it might be one of the causes of erectile dysfunction as well. Please try to understand. Swelling of the prostate, right? Important point. Try to remember this. So these are the things from the zinc deficiency. Okay, coming to question number 5. आराम से इसको देखेंगे. मैं सैड बिल्कुल नहीं हूं. आई एम वेरी हैप्पी दैट ऑल ऑफ यू गाइज आर गोइंग टू पास. यस, वी आर गोइंग टू पास माय डियर फ्रेंड्स. यस. क्वेश्चन नंबर 5. This is not a bouncer. This is a Yorker. This is Yorker. Yorker is allowed. Bouncer already 2 I have given. Now Yorker. जल्दी से देखेंगे. आंसर. हेलो. एग्जाम डिफिकल्ट बोल के कुछ नहीं होता. अगर आपको आंसर मालूम है आपके लिए एग्जाम इजी है. अगर आपको आंसर मालूम नहीं है तो आपके लिए वो डिफिकल्ट होगा बेटा. ऐसा कुछ नहीं होता है. प्लीज रिमेंबर, इट ऑल डिपेंड्स ऑन हाउ प्रिपेयर्ड यू आर. इफ यू आर गेटिंग द कॉमन क्वेश्चंस यू विल कम आउट ऑफ द एग्जाम हॉल एंड टेल मी सर सारा कुछ कॉमन आ गया, पेल दिया, फाड़ दिया. बट सपोज इफ यू मेक ए सिली मिस्टेक देन द सेम इजी एग्जाम माइट बिकम डिफिकल्ट. ऐसा कुछ नहीं होता है बेटा. आराम से वी विल गो विद अ पॉजिटिव अप्रोच एंड वी विल ट्राई टू गेट द मैक्सिमम मार्क्स पॉसिबल इन द अपकमिंग एग्जाम. आंसर आ गया, मैंने ध्यान ही नहीं दिया. क्या हुआ, ये क्या हुआ. कंफ्यूजिंग आंसर्स आर कमिंग. रिमेंबर माय डियर फ्रेंड्स. अरे भाई इसको हमेशा बायोकेमिस्ट्री में डी नहीं लगाना है. आई टोल्ड यू गाइज आर गोइंग बाय माय मंत्रा ऑल द टाइम दैट यू आर गोइंग फॉर ऑप्शन नंबर डी. कुछ मालूम नहीं पड़ रहा है तो डी आंसर करके आएंगे. अरे ऐसा थोड़ी ना होता है. नाउ ट्राई टू रिमेंबर दैट द सही आंसर ऑफ दिस क्वेश्चन माय डियर फ्रेंड इट इज बफेलो मिल्क. बफेलो देंगे, भैंस का दूध पिलाएंगे. इस पेशेंट को भैंस का दूध पिलाएंगे. ये देखो थोड़ा सा ट्रिकी क्वेश्चन. आई टोल्ड यू इट इज ए योरकर. आई हैव बोल्ड ए योरकर. नाउ ट्राई टू फोकस. 24-year old boy at your age, grade 2 obesity. ऑब्वियसली विल ज्वाइन द जिम फॉर वेट रिडक्शन. लोगों को इंप्रेस भी करना है, शादी भी करना है, एक दूसरे का लेना भी है. प्लीज रिमेंबर इन दिस केसेस इट इज ऑन द वर्ज ऑफ मॉर्बिड ओबेसिटी. ग्रेड 2 ऑलमोस्ट क्लोजिंग नियर टू 40. BMI ऑलमोस्ट नियरिंग 40. Please remember he is also not doing much of the physical activity, and please remember you have already put him on keto diet along with daily gym भी जा रहा है, keto diet भी कर रहा है. While preparing for a diet chart for him, which of the following type of milk will be most suitable? कौन सा दूध पीने के लिए बोलेंगे? अरे दूध देंगे नहीं, ऐसा थोड़ी ना होता है यार. ये क्या है, डी क्यों मार कर रहे हो यार? प्लीज रिमेंबर वी हैव टू गो फॉर लॉजिकल आंसर दैट इज बफेलो मिल्क. Actually see keto diet. What is keto diet? Keto diet, my dear friends, we all know it is low carb. We are giving high protein, and high fat diet. Low carb, high protein, high fat diet. Okay, calories ज़्यादा है but still we are able to give this. Which of cow's milk, goat's milk हम लोग नहीं देंगे. I will try to show you this. Try to understand over here. High protein, high fat. That is the point of focus in the keto diet. Now let us try to quickly see. I will come to that calorie thing. My dear friends. Calorie के चीज में आएंगे. Calorie में जरूर आएंगे. Try to first look at those. Human milk के साथ comparison है cow, buffalo, goat. देखो first of all try to look over here. Our point of focus. Cow में carbohydrate 4.4, goats में 4.6 and buffalo में 5.4. Okay, it is high. Ideally it should not be given, but please try to understand. Lipids को देखोगे, fat intake को देखोगे, that's why it is getting maximum over here. Remember, in case of buffalo milk we are having maximum fat over here. Not only that, you are also having maximum protein. I told you in keto diet we don't go for over consumption. No. In keto diet you don't eat more. You eat something little bit extra that can give you more energy. We want the energy to be produced. Yes, we want the calorie because we want to maintain our body's requirement, but you don't want to eat carb. Although carbohydrate is little bit excess, but the important point is that buffalo milk in little bit extra quantity can give you too much of fat and too much of protein as well, which is far higher than cow or goat. That's why if you are focusing on the milk part, ideally buffalo milk can actually give you increased lipid as well as increased protein. If you give little bit of extra buffalo milk to be given to this patient, then the energy will be sustainably increased over here, and the patient also can maintain the keto diet. Sometimes remember beta, buffalo milk is actually one of the cheap source of high protein and high fat. Keto diet is not easy. Poor patients, they cannot afford keto diet. Poor obese patient, it is costly. Keto diet is costly. It is not rice. You are going for protein and fat intake. Those are costly. One of the cheap source to get this excess amount of fat and excess amount of protein, it is our buffalo milk over here. Please remember, important point to be noted, इसको ध्यान देंगे हम लोग. हाई फैट भी देना है. आई टोल्ड यू फैट इन लिटिल बिट एक्सेस क्वांटिटी एंड प्रोटीन ऑल्सो इन लिटिल बिट. यहां पर देखो सबसे ज्यादा जो चीज ज्यादा है दैट इज फैट. That's why little bit, 1 glass of buffalo milk every day can also give you huge amount of energy, my dear friend. This is the take home point that you will understand, that whenever we are talking in terms of buffalo milk में benefit ये है कि इसमें fat है. You can also give that patient ice cream because ice cream is also giving you more fat. Sugar कम होता है, fat ज्यादा होता है. Compared to carb, it is fat that is highest over here. That's why buffalo milk also can be preferred. Buffalo milk can be also preferred. Yes, national diet of Haryana. कौन है ये? हरिओम. चलो चलो ठीक है. Okay. Please remember. Calcium wise, it is goat where is maximum. That's why many people will try to give goat's milk to the newborn child for calcium growth. एक बार इसको देख लेते हैं बेटा, बाई चांस अगर यहाँ से कुछ आ गया तो. कैल्शियम कहां पर मैक्सिमम है? प्लीज रिमेंबर, गोट्स मिल्क में मैक्सिमम होता है कैल्शियम. Human breast milk, it is very low. That's why sometimes we are also giving goat's milk. Goat's milk हम लोग क्यों देते हैं? Most important answer is for beta calcium. Calcium is maximum in case of goat's milk. That's why many people try to prefer that. Right? At least try to remember this point, beta ji. This is the important point that we have to try to focus over here. हम बाकी चीजों को ध्यान उतना नहीं दे रहे. गोट्स मिल्क में कैल्शियम सबसे ज्यादा है. इस पॉइंट को भी एक बार हम लोग मार्क कर लेंगे, है ना. आगे बढ़ते हैं. लेट अस ट्राई टू मूव टू द नेक्स्ट क्वेश्चन ओवर हियर. आगे बढ़ते हैं. क्वेश्चन नंबर 6. क्वेश्चन नंबर 6 इसको देख लेंगे आराम से. क्वेश्चन को पढ़िए देन आंसर कीजिए. दिस इज इजी. चॉकलेट क्वेश्चन. लुक्स बिग बट इजी क्वेश्चन. आराम से. आंसर. अरे इजी है. दिस इज इजी माय डियर फ्रेंड्स. यस. ये अरे नहीं, दोबारा देखो. सही हो. राइट आंसर. Answer of this question, beta. Answer of this question. Yes. All of you now are coming out with the right answer. This is C, beta. C. This is glycogen phosphorylase. First of all, what is the diagnosis of this case? This diagnosis, my dear friend, is McArdle's disease. This is a case of McArdle's disease, है ना. कौन सा केस है बेटा ये? McArdle disease, and all of you know McArdle disease, M for M. This is actually due to the deficiency of the muscle glycogen phosphorylase. It is due to the deficiency of muscle glycogen phosphorylase. McArdle disease, हाँ बिल्कुल सही. I told you this McArdle disease acute attacks are also common more in case of female than in males, because females, they have less creatine phosphate stored in their muscle. That's why whenever they are going for the heavy exercise, please remember, after the 1 minute of exercise, MS Dhoni, Usain Bolt story, those things, after the first minute, it is muscle glycogen which should take over, and if it is not able to produce the required number of ATP, then the muscle protein myoglobin will be coming out to help you out, to give you the ATP. As myoglobin is mobilized, some amount of myoglobin has to come in the urine, which will give you the Coca-Cola like color. This is also called as cherry soda pop. याद है, हमने पढ़ा था. There was something also called as cherry soda pop. There was something known as cherry soda pop, CSP, cherry soda pop. Remember, we have discussed this cherry soda. Exercise intolerance, exercise induced myoglobinuria. In myocardial disease, the word was exercise induced myoglobinuria, है ना? Exercise induced myoglobinuria. Exercise induced myoglobinuria. This is the point that we have also discussed earlier. Exercise induced myoglobinuria can be also notified. And please remember, you are able to appreciate Coca-Cola. Har cola, please remember, Coca-Cola nahi hota. Remember, every cola is not Coca-Cola. Remember this point, we have discussed this. Cherry soda pop, exercise intolerance. Exercise intolerance. Glycogen synthase deficiency is that Lewis disease, where in the liver there is no synthesis of glycogen in the first place. Glucose 6 phosphatase, all of you know von Geerk's disease है ना, von Geerk's, where we have problems with hypoglycemia. आप लोगों ने शायद ये सोचा लॉस ऑफ कॉन्शियसनेस मतलब दिस इज ओनली हाइपोग्लाइसीमिया. नो, समटाइम इट माइट बी ड्यू टू सडन लैक ऑफ ATP in our working muscles. Please try to understand. Phosphofructokinase deficiency is called as Tarui's disease. That is muscle phosphofructokinase, where we have different set of things. We have excessive deposition of glycogen in the muscle, right? In that case, the patient becomes too much swelled up or too much obese. गुब्बारे जैसा दिखता है patient. Too much of swelling of the patient due to deposition of glycogen. That is a different story altogether. This is the case of myocardial disease. Females पे ज़्यादा होते हैं acute attacks as compared to males. चेरी सोडा पॉप, एक्सरसाइज इंड्यूस्ड मायोग्लोबिन्यूरिया, राइट. इंपॉर्टेंट पॉइंट, इसको देख लेना एक बार. आगे बढ़ते हैं टू द नेक्स्ट क्वेश्चन. इसका आंसर बोलो, बैक टू बैक दे रहा हूं, इजी है टू डायग्नोस. आंसर ऑफ दिस क्वेश्चन, आंसर ऑफ दिस क्वेश्चन, इजी थिंग माय डियर फ्रेंड्स. जल्दी से इसको देख लेते हैं. आप सब लोग इसका आंसर जरूर बोल पाओगे. आई हैव इमेंस बिलीव इन ऑल ऑफ यू दैट ऑल ऑफ यू माय डियर फ्रेंड्स विल बी कमिंग आउट विथ फ्लाइंग कलर्स ऑन दैट डे ऑफ 6th of July. You will be able to answer correctly. Okay. आंसर 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 आंसर. ये इजी है. हेलो, अरे यार ये तो इजी है. दिस इज इजी, दिस इज इजी, दिस इज इजी. यस 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 यस. इंपॉर्टेंट पॉइंट जिसको हम लोग ध्यान देंगे बेटा जी. इंपॉर्टेंट पॉइंट. यस यस, ऑल ऑफ यू आर कमिंग आउट विद द राइट आंसर बेटा जी. This is C, von Geerk disease. Arey, look over here. Remember, we are having bulged out abdomen, pot belly, bulged out abdomen, my dear friends. We have heard that this is a case of pot belly, bulged out abdomen, pot belly. Remember that increased appetite because there is fasting type of hypoglycemia multiple time. The child is actually not able to maintain the blood sugar level. That's why increased appetite. Please remember, we have hepatomegaly, xanthoma, thigh region, and as well as doll-like faces with fatty cheeks. And gold standard diagnosis, which is called as ABG analysis, you are also seeing acidosis, right? Important point to be noted, beta. And also you to try to focus, there can be fatty infiltration because it might lead to also fatty liver. Most likely diagnosis, von Geerk's disease. Option number C, von Geerk's disease. Hypoglycemia. All of you my dear friends has come up with the right answer. All of you are right. All of you, all. This question is going to come and you will be able to mark this correctly on the exam day. So this is glycogen storage disorder. Quickly summarizing, neonatal period, we have already discussed hypoglycemia or lactic acidosis. After 3 to 4 months, hepatomegaly, hypoglycemic seizures. There is something called as doll-like faces with fatty cheeks. Extremities are thin, short stature, protuberant abdomen, enlarged kidneys. Main four features over here: hypoglycemia, lactic acidosis, hyperuricemia, and hyperlipidemia. Despite of all these, we are having something called as normal transaminases. इतना सब कुछ हो गया, but liver function test will be normal. Liver function test will be normal transaminases, my dear friends. Look over here, we can also get to see xanthoma formation, highlighting the most important point: xanthoma formation. Excess acetyl CoA will be diverted for cholesterol synthesis, my dear friends. That is lipemia, acidemia, ketosis, all this ketoacidosis, ketone body production, and ultimately after 6 months it can also lead to gout. Remember, galactose, fructose, glycerol are also metabolized to lactate. How do you treat? Remember, we can give some nasogastric tube. NGT stands for nasogastric tube. Riles tube. Infusion of glucose, or you can give oral uncooked cornstarch. Remember, nasogastric tube. NGT stands for Riles tube. Oral infusion, nasogastric tube, Riles tube, oral cooked cornstarch. This one can give oral uncooked cornstarch. Uncooked. ध्यान देंगे बेटा. Oral uncooked. Remember, important point. Oral uncooked cornstarch we have to be given over here. Remember this. This is the important point that we will have to try to remember over here, right? Von Geek disease. आगे बढ़ते हैं. Question of this. Hope you are able to target this question. ये easy है. You guys are right, my dear friends. क्या बात है. All of you are right, beta. All of you are right. Yes, beta ji. The answer is cholesterol. Answer is cholesterol, beta. Male patient presented to with hepatosplenomegaly, and there is also knuckle xanthoma. Hello, knuckle xanthoma, extensor surface. Diagnosis. What is the disorder name? Type 2. क्या बात है. Type 2 hyperlipoproteinemia. Type 2A. The diagnosis of this patient is type 2A. This is type 2A. What is the name of type 2A, beta? This is called as primary familial hypercholesterolemia. This is called as primary familial hypercholesterolemia. Primary familial hypercholesterolemia है ना बेटा. Diagnosis is type 2A. Hardik, you are exactly right beta. Sachin, yes. Ankita, Suraj, yes. All of you are right beta. Tendon xanthoma वगैरह common है. Extensor surface. I told you, if it is on this side of your hand, then it is type 2A. But if it is on this side of our hand, palmar creases में होता है, diagnosis will change to type 3. Never ever make that mistake. इस side में हुआ on knuckles, type 2A. On this side, if you see over the palm, then it is our type 3. Primary familial hypercholesterolemia. Please remember, primary familial hypercholesterolemia. All of you are right, beta ji. Type 2A is the most common type of hyperlipoproteinemia in India as per Frederickson-Levy-Lees classification, FFL. Frederickson-Levy-Lees classification, FFL classification. Remember, Levy-Lees, FLL classification. What is this FLL classification? One more time, Frederickson, Levy and Lees. classification. Remember, type 1 is also called as chylomicron syndrome, where we have overproduction of the chylomicron, my dear friends. Cholesterol level will be normal because in chylomicron we don't have much of cholesterol. TAG level will be shooting up in case of type 1. That is due to ApoC2 deficiency or LPL deficiency, lipoprotein lipase. And remember, my dear friends, type 2A, that is the question that we are targeting over here. It is called as primary familial hypercholesterolemia, where there is a fraction that is elevated is LDL. Cholesterol छप्पड़ फाड़ के increase होगा, cholesterol will be increased too much, and TAG will be normal, and this is due to LDL receptor deficiency at the peripheral tissue level. LDL uptake नहीं होगा. So look at the contrasting picture. Type 1 TAG high, cholesterol normal. In case of type 2A, cholesterol high, TAG normal. Exactly opposite. At least remember this much. My dear friends. And please remember, it is the most common type over here. It is autosomal dominant. Please remember, usually survive by maximum second decade. Ischemic heart disease, tendon xanthoma, corneal arcus, xanthelasma. These are the problems associated with the type 2A primary familial hypercholesterolemia. I'm not going for the much of the discussion of the 2B, 3, 4 and 5. Those are the remaining. Total 6 types of disorders are there. Those are not much asked in our exam. You might skip this. Try to at least remember these two better, type 1 and type 2A. Right. Hope this is crystal clear to all of you. आगे बढ़ते हैं to the next question. Next question. इसको देखते हैं. Next question. Yes. Next question. Yes. Answer. All of you are more or less coming out with the right answer, beta. Yes, most of you are coming with the right answer, beta ji. Hope this is clear to all of you. Yes. Try to approach this question peacefully, slowly. 40-year-old male. Okay. Generalized weakness. I taught you this two word, my dear friends, multiple time. Recent complaints of loss of appetite. Okay. Swelling around bilateral ankles whenever walks a mile. That might be a sign of edema. Please remember, he is an alcoholic. Daru, khamba. Since last 15 years, he is putting khamba within himself. Please try to understand. That's the reason, my dear friends. All of us know that most common cause of vitamin B1 deficiency in India, it is chronic alcohol intake or chronic alcoholism. And this patient is, my dear friend, deficient of vitamin. Yes. And for B1 deficiency assessment, it is done by RBC transcromatosis. RBC transcromatosis can assess vitamin B1 deficiency. So the answer of this is actually vitamin B1 deficiency, but they have asked which is the test you will do, that is called as RBC transcromatosis. In this regard, also try to remember RBC glutathione reductase. My dear friends, it is assessed in case of B2 deficiency. Right? RBC transaminase B6, Figlu excretion test, it is for B9, methyl malonyl CoA test, it is for B12. Remember, these are the 5 vitamin deficiencies that can be assessed like this. One more final time. RBC transcromatosis B1, RBC glutathione reductase B2, RBC transaminase B6, then Figlu excretion test for B9, which is also known as histidine loading test, and please remember B12 के लिए methyl malonyl CoA that we have already discussed earlier. Right? This is crystal clear to all of you. Hope you are all correct on this. Okay. This question, क्या है ये question? Which is this question? Try to look over here carefully. लंबा चौड़ा हिस्ट्री दिया है, काम का चीज एक ही जगह पर है. So much of history, so much of history, but what is the right answer? What is the right answer, my dear friends, of this question? This we have discussed. Read, don't jump the gun, don't jump the gun. Read it. Yes, if you read, answers will come. If you read, answers will come. पढ़ना पड़ेगा, not inky pinky ponky. Abracadabra nahi hai ye. Please try to remember. You have to read it. Yes, the answer of this question. Now you are coming out with the right answer, Sachin. Yes, it is C. It is C. It is C. Yes. Now all of you are coming out with the right answer. सही जवाब, बिल्कुल सही. Yes. Try to look over here, beta. What is the question that they have asked? Ammonia formed in brain is detoxified. भाई हो गया, कहानी समाप्त. झंडा गाड़ दिया. दैट इज द पॉइंट, वी विल रिमेंबर. बाकी कोई कुछ भी बोले, हमको उससे क्या लेना देना भाई. रिमेंबर, ब्रेन में अमोनिया डिटॉक्सिफिकेशन इज डन बाय दिस गाय ग्लूटामिन. लंबा चौड़ा हिस्ट्री दिया है, इसका क्या कुछ काम नहीं है. दैट्स व्हाई वी से रीड द लास्ट लाइन फर्स्ट. Read the last line first. Answer will come from there itself. It is a chocolate question actually. Only thing we have just cooked up some story over here. That's why you are getting confused initially. Right. Please try to remember. This is a case of hyperammonemia, chronic liver disease, hepatic encephalopathy. Yes, hepatic encephalopathy. Medico. Yes, you are right. Hepatic encephalopathy. Shubham, you are right. Case of hepatic encephalopathy. But from biochemistry they have asked how you will be able to manage this excess ammonia level in the brain, that is by producing glutamine. Remember, glutamine is actually from most tissues, in most of the tissues and in brain, and alanine is actually from the muscle. Alanine is actually from the muscle. Remember, important point to be noted. Important, right? Hope this is all clear to all of you. Yes, एलानिन मसल के लिए आंसर करके आना है बेटा, एंड मोस्ट टिश्यूज एंड ब्रेन के लिए आंसर करके आना है ग्लूटामिन. राइट, इन दोनों को याद करेंगे हम लोग. मोस्ट टिश्यूज एंड ब्रेन में अमोनिया डिटॉक्सिफिकेशन डन बाय ग्लूटामिन, एंड मसल में एलानिन. भाई यूरिया तो प्रोडक्शन होगा, हाउ कैन यू गो फॉर डिटॉक्सिफिकेशन ओवर देयर? इट इज द ब्रेन. यूरिया तो लिवर में प्रोडक्शन होता है ना, यूरिया इज लिवर. ग्लाइसिन एक्चुअली डजंट डू मच in case of this handling of the ammonia level. So please try to understand. Lot of history has been cooked up, but mainly we can pay attention and try to focus that ALT enzyme actually has increased too much. ALP is borderline. Remember, plasma ammonia level बहुत ज़्यादा हो गया है. Normally we say up to around 30-35. In here I have mentioned 11 to 32 micromoles per liter is normal, but यहाँ पर बहुत ज़्यादा है. This is the case of hepatic encephalopathy mainly, है ना. इसमें हम लोग ग्लूटामिन के थ्रू अमोनिया डिटॉक्सिफिकेशन थोड़ा बहुत कर पाएंगे फ्रॉम द ब्रेन टू द लिवर इन सेफ फॉर्म विदाउट कॉजिंग मच ऑफ हाइपर एमोनेमिया फर्दर. ऑलरेडी डैमेज हो चुका है, कितना डैमेज अलाउ करेंगे, राइट? दिस इज द पॉइंट. सो अमोनिया ट्रांसपोर्ट में हम लोगों ने देखा था बेटा, वी हैव स्टडीड, टेकन फ्रॉम आवर बायोकेम वर्कबुक. इट इज अवर ग्लूटामिन दैट इज इंपॉर्टेंट फॉर द ट्रांसपोर्ट फ्रॉम मोस्ट टिश्यूज एज वेल एज फ्रॉम ब्रेन. यहाँ से ट्रांसपोर्ट हम लोग कुछ इस तरीके से कर लेते हैं, एंड अल्टीमेटली दे विल बी कमिंग टू द लिवर, and from the skeletal muscle, my dear friends, we are able to capture the ammonia in the form of alanine. And during that we have also seen that alanine comes over here by transamination, gets converted to pyruvate. Pyruvate goes for glucose by the process of gluconeogenesis, and the glucose is again given back to the skeletal muscle, that by the process of glycolysis finally will be again getting converted back to pyruvate. And this interconversion in the muscle to liver, ultimately we call this special cycle as glucose alanine cycle, which is also called as Cahill cycle. इसी cycle का दूसरा नाम होता है बेटा जी Cahill cycle. This is known as Cahill cycle, glucose alanine cycle, also known as Cahill cycle. This we have discussed during our classes. Cori cycle for lactate, Cahill cycle for alanine, है ना. Yes, we can go for lactulose. Yes, lactulose therapy can be given over here beta ji, I guess. Yeah, शुभम. Okay, right आंसर बेटा. केहिल साइकिल को याद कर लेना है ना बेटा जी, इसको याद करेंगे हम लोग. आगे बढ़ते हैं टू द नेक्स्ट क्वेश्चन. क्वेश्चन नंबर 11 जल्दी से देखते हैं. क्वेश्चन नंबर 11 आंसर. chocolate question, chocolate question, chocolate question, chocolate question. Please remember chocolate question that we have to try to remember over here. Chocolate question, chocolate question, chocolate question. All of you are right. All of you are right. All of you are right. Without any difficulty, my dear friends, we all can mark this answer correct. अरे कितना सारा हिस्ट्री दिया है सर, अरे बाप रे, काम का चीज कहाँ है? Please remember, it is a case of gout because it is precipitated by consuming alcohol. वोडका पिया है, लिया है, दिया है, जो भी किया है. Now he is coming with great toe swelling. My dear friends, please try to understand classical history of a case of acute attack of gout, and we have to go for estimation of the synovial fluid uric acid after doing arthrosynthesis. After doing arthrosynthesis, आर्थ्रोसिंथेसिस के बाद याद करेंगे हम लोग, वी विल ट्राई टू एस्पिरेट द साइनोवियल फ्लूइड एंड देन वी विल ट्राई टू सेंड इट टू द लैब and then we will go for birefringent needle shaped crystals with negative elongation. Needle negative, needle negative, needle negative. Diagnosis will go for case of gout. We don't check for plasma uric acid because in plasma uric acid, remember my dear friends, we have studied during our classes at MIST that acute gout के केस में plasma uric acid will be normal or even low. Yes, acute attack of gout में uric acid level in the blood either will be normal or even low. Never ever send the blood sample, you will miss the diagnosis. You will have to go for fluid aspiration, synovial fluid aspiration from the joints, right? This is the thing that we will have to remember. Arthrosynthesis, please remember. This is the classical appearance of this crystal. I told you this is the sea of blue, sea of green appearance, sea of blue, sea of yellow appearance. Remember my dear friends that blue when perpendicular as well as yellow when more or less horizontal. This is the point that we have to remember over here beta. इस चीज को हम लोग ध्यान देंगे एक बार, right? This is a sea of blue, sea of yellow appearance, sea of blue, sea of yellow appearance. These are what type of crystal beta? These are called as monosodium urate crystal. These are having needle shape negative elongation, needle negative. What about a case of pseudo gout? In pseudo gout, my dear friends, we have something called as rhombic plates, and we are having something called as positive elongation. Rhombic positive, ropo, pseudo. And in case of gout, needle negative, needle negative, it is gout. Remember this. Needle negative gout, ropo, rhombic positive, remember this MSU. In case of what is the name of the crystal by the way? pseudo gout में कौन सा crystal होता है बेटा? CPPD. What is this crystal बेटा? CPPD, calcium pyrophosphate dihydrate, CPPD. Please remember. Ropo, pseudo. Gout, remember CPPD, calcium pyrophosphate dihydrate crystals are seen in case of pseudo gout may please remember CPPD, important point. Try to remember this beta. Hope this is we are able to remember this beta. This would come in the upcoming FMG exam. Very important my dear friends, please remember this. Okay, जॉइंट चलो देख लेते हैं. MSU, acute gout. In case of acute gout, the most common joint that will be involved will be the great toe over here. That is also called as podagra. Great toe में जो deposition होता है बेटा, this is called as podagra. In case of pseudo gout, the most common my dear friend will be the knee joint. मोस्ट कॉमन विल बी द नी जॉइंट. यहाँ पर नी जॉइंट होगा, है ना. नी जॉइंट, इंपॉर्टेंट, प्लीज रिमेंबर, मोस्ट कॉमन यहाँ पर नी जॉइंट होगा, वहां पर इट विल बी द ग्रेट टो, ग्रेट टो, ग्रेट टो, ग्रेट टो, गाउट गाउट गाउट, गाउट गाउट गाउट, pseudo gout, my dear friends, please remember it is knee joint, knee joint, knee joint, knee joint, remember this, right? Hope this is crystal clear to all of you. आगे बढ़ते हैं, आगे बढ़ते हैं बेटा, आगे बढ़ते हैं. ओके, सी दिस, सी दिस, सी दिस, सी दिस, सी दिस, देखते हैं, देखते हैं, देखते हैं. इसका आंसर अगर आपने गलत किया ना, सीरियसली कैमरे में घुस जाऊंगा मैं एकदम. आंसर, 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 आंसर. Yes, 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 yes. All of you are coming out with the right answer. क्या बात है बेटा जी. Hats off to all of you guys. Excessive curly hair, Menkes kinky, kinky. Remember, my dear friends, Menkes kinky hair syndrome. Important point to be noted. Collagen cross-linking problem. Rare disorder. Rare, 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 rare कहाँ है? Rare, rare, rare. Rare, yes, rare word, rare disorder, but asked in our exam, ATP7A gene mutation. ATP7A gene mutation leads to Menkes kinky hair syndrome, copper deficiency. Menkes kinky, ATP7A gene mutation, we are having copper का deficiency, copper decreased. ATP7B क्या होता है? ATP7B विल्सन डिजीज, कॉपर एक्सेस, पूरा ऑपोजिट, विल्सन डिजीज. कोलाजेन 1A1 जीन म्यूटेशन, 1A1 जीन म्यूटेशन, वी कॉल इट एज ऑस्टियोजेनेसिस इम्परफेक्टा. 1A3 बोल के कुछ नहीं होता है बेटा, एक्चुअली इट शुड बी रिटन एज 3A1. 3A1 deficiency causes Ehlers-Danlos syndrome also. Remember, 1A3 बोल के कुछ नहीं होता है, 3A1. Remember, 3A1. Remember, this is the important point we will try to remember. Copper deficiency, Wilson disease, copper excess, collagen 1A1 gene mutation, osteogenesis imperfecta, 3A1 gene mutation, and 5A1 gene mutation. It is Ehlers-Danlos syndrome. Ehlers-Danlos syndrome. Remember, in case of Ehlers-Danlos syndrome, most common it is due to collagen 5A1 gene mutation. It is mostly due to 5A1 gene mutation. Ehlers-Danlos syndrome, 5A1. 5A1. All of you are correct, beta. All of you are correct. Great, 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 great. We are thinking in the right lines. You are right. You are right. You are right. What is this? Kinky. Yes. This is a classical image of a child suffering from Menkes kinky hair syndrome. Spike cut. Spike cut. Spike cut. Football players. Spike cut. Remember, look over here. Kinky type of. Actually, not too much of curly. It is actually becoming straighter like this. This is a classical image of a child suffering from Menkes kinky hair syndrome. Remember this image. Remember this image. Also try to look over this child. Look at this over here. Spike cut like hair. This is Menkes kinky hair syndrome. Remember, important point to be noted. This is the two images for Menkes kinky hair syndrome. Both are for Menkes kinky hair syndrome. Please remember. Important point. Try to focus on this. Right. Hope this is crystal clear to all of you. आगे बढ़ते हैं. आगे बढ़ते हैं, आगे बढ़ते हैं. आंसर करेंगे, आंसर करेंगे. ये थोड़ा टफ है, थोड़ा सा टफ है. सोचेंगे, सोचेंगे, सोच के आंसर करेंगे. प्लीज ट्राई टू लुक ओवर हियर. All of you are coming out with right answer. If you have got this one correct, really hats off to you, my dear friends. This is a case of xeroderma pigmentosum. And xeroderma pigmentosum, it is actually a defect in a DNA repair system that is called as NER, or nucleotide excision repair. न्यूक्लियोटाइड एक्सेशन रिपेयर। अगर इसका डिफेक्ट होता है ना तो हमारे पास एक डिसऑर्डर होता है बेटा जिसको हम लोग बोलते हैं जीरोडर्मा पिगमेंटोसम। जीरोडर्मा पिगमेंटोसम, इट इज अ डिसऑर्डर ड्यू टू NER defect, nucleotide excision repair defect is called as this. It is also predisposing to cancer at a later stage if not attended on time. Now try to remember, we have a big list of this sort of defects. No need to mug up all this. Don't panic beta, don't panic, don't panic, don't panic. We have a big list over here. Don't panic. First of all, don't panic. Remember, we have got total 6 types of DNA repair system. ध्यान देंगे, ध्यान देंगे. We are having some 6 types of DNA repair system. If we have a defect in the DNA repair, then we have multiple disorders. These are very dangerous type of disorder because the problem will be arising from our DNA level itself. DNA is not able to get repaired by himself, right? First of all, if you have nucleotide excision repair defect, we have two type of disorder which is called as xeroderma pigmentosum or trichothiodystrophy, which is called as TTD. Trichothiodystrophy, TTD. That is something called as, important point to be noted over here, important point, this is called as strand directed mismatch repair defect. Many people, they don't write the word strand directed, they just write MMR defect, MMR defect. We have a disorder called as HNPCC. What is HNPCC? Hereditary non-polyposis colorectal cancer, which is also known as Lynch syndrome. आपने सुना होगा Lynch 1, Lynch 2. These are due to MMR defect. Base excision repair, we have Muti associated polyposis, MAP, Muti associated polyposis, MAP. Remember. Now we have something called as DSB repairs. DSB repairs, my dear friend, we got also have two types. Important point to be noted. Remember, either HR or homologous recombination or NHEJ, which is called as non-homologous end joining. If we have HR defect, then it is called as either Bloom syndrome or Werner syndrome. What is Werner syndrome? Adult onset progeria. All of you know there was a movie called Pa. Amitabh Bachchan, Pa. Remember, Pa. Werner syndrome, my dear friends, Werner syndrome, my dear friends, that we have to remember. Werner syndrome is actually adult onset progeria. Please remember, premature aging. We also have something called as RTS, Rothmund-Thompson syndrome. Then we have something called as Neuro-Behcet's disease or Neuro-Behcet syndrome, also BRCA1 or BRCA2. Remember, in non-homologous end joining, if we have a defect, we have also sensitivity to radiation, loss of lymphocytes. We have ataxia telangiectasia. Ataxia telangiectasia, ATM gene. What is ATM full form? Ataxia telangiectasia mutated gene. Gene का नाम ही है Ataxia telangiectasia mutated gene. And we might also have Fanconi's anemia. And remember, if you have transcription coupled repair defect, some people, they write the full name transcription coupled nucleotide excision repair, then it is called as Cockayne syndrome. Many books write Cockayne syndrome as direct nucleotide excision repair defect. That is wrong. Cockayne syndrome is a late type of NER that is linked with transcription coupled nucleotide excision repair. This is called as beta Cockayne syndrome. Ore baba re baba re. So many disorder. Let us try to remember this. In short, only highlight the points which I am highlighting in green color. You remember xeroderma pigmentosum. You remember HNPCC. You remember, my dear friends, ataxia telangiectasia, non-homologous end joining, and remember Cockayne syndrome. ये चार को एटलीस्ट मार्क कर लो फॉर आवर FMG एग्जाम बेटा. Xeroderma pigmentosa, HNPCC, then ataxia telangiectasia, and we have Cockayne syndrome, जिसमें आंसर करके आना है transcription coupled NER. If transcription coupled word is not given, then you can mark the answer as only nucleotide excision repair. This is a special type of NER which is linked with transcription, whose defect is leading to Cockayne syndrome, right? This is an important point. Although we have not discussed much about molecular biology during the classes, but these are some questions which might be appearing in the exam. Coming to this question. Coming to this question. Answer. Answer, answer, answer. A big round of applause for all of you, beta. That the answer of this question, it is 5-hydroxyindole acetic acid. We have already discussed this earlier, beta, that this is a case of argentophenoma. Remember, beta, malignant carcinoid syndrome, argentophenoma, there is a ratio change in the urine. We go for diagnosis of 5-hydroxyindole acetic acid, right? Just to make you recall the question, beta ji, important point. Remember, malignant carcinoid syndrome, इसको एक बार देख लेना बेटा. Diagnosis done by 5-HIAA. All of you remember. 5-hydroxyindole acetic acid, gold standard parameter. We also have some other marker called neuron specific enolase or synaptophysin, but 5 here is a superior marker, 5-HIAA. All of you are right. You are correct, my dear friends. FIGLU, it is for B9 deficiency assessment. FIGLU is for B9 deficiency assessment, right? B9 deficiency के लिए FIGLU होता है. आगे बढ़ते हैं, 15 में आते हैं. 15. Question. Think. Answer. थोड़ा सा टफ है ये. Again, I have bold a bouncer. It is a bouncer. Beamer डाल दिया. Beamer. Okay. Answer of this question. ये क्या है? What is this? What is this question? Yes, you are able to tackle bouncer. क्या बात है, कूद के हुक मार रहे हो. अरे बाप रे. सही आंसर. राइट आंसर, my dear friends. Maple syrup urine disease. You are right. BCKD. क्या बात है, डायग्नोसिस कैसे किया? अरे burnt sugar smell in urine, so it is not mentioned. But yes, you guys are right, my dear friends. Refusal to suck breast milk. This word I taught you, it is mainly galactosemia, but galactosemia option is not there. That means it will be something else. Occasional seizures, secondary hypoglycemia. Remember, secondary hypoglycemia is classically seen in case of maple syrup urine disease. And there is also chance of ketosis, and it is a type of organic aciduria that has been mentioned. We have studied that we have branched chain ketonuria. We have something called as branched chain ketonuria. We have something called as branched chain ketonuria in case of maple syrup urine disease, beta. And this is actually due to deficiency of the enzyme BCKD complex. This is due to deficiency of the enzyme BCKD complex, branched chain alpha ketoacid dehydrogenase complex. Remember beta, ये जो feature है, यहाँ पर actually we don't get to see much of ammonia level high in the blood, normal ammonia level. That's why it will rule out urea cycle enzyme defect, है ना? Urea cycle enzyme defect will be ruled out. Urea cycle enzyme defect will be ruled out because there is normal ammonia. Normal ammonia है, तो this cannot be the answer. Propionic acidemia, we have got different features. We don't get to see secondary hypoglycemia over there. Please try to understand this. Seizures and all, it is not seen. Propionic acidemia, please try to remember. Secondary hypo, it is seen, but seizures are actually absent in propionic acidemia. In multiple carboxylase deficiency, please remember, In case of this, we have skin manifestations as well. We have skin manifestations positive. Skin manifestation is positive. Skin manifestations are positive in case of multiple carboxylase deficiency. That is not mentioned over here. So that's how you try to rule it out. प्रोपियोनिक एसिडेमिया में सेकेंडरी हाइपोग्लाइसीमिया दिख सकता है बट सीजर्स वगैरह नहीं होता है. प्लीज रिमेंबर दिस. वी डोंट गेट टू सी मच ऑफ ऑर्गेनिक एसिडूरिया एज वेल ओवर देयर. आंसर ऑफ दिस लॉजिकल, इट इज maple syrup urine test, burnt sugar. Yes, oxidative decarboxylation, DNPH test, DNPH, dinitrophenyl hydrazine. Phenyl hydrazine, hydrolase नहीं बेटा, hydrazine, dinitrophenyl hydrazine test we can also do. राइट, इंपॉर्टेंट पॉइंट टू बी नोटेड. टॉम कैट यूरिन में भी ये होता है. क्या बात है, डिटेल में पढ़ के आए हो. ग्रेट. टॉम कैट यूरिन, रिमेंबर टॉम कैट यूरिन में होता है. Great, my dear friends, you have studied extra. Yes, during the chart in the workbook we have also tomcat urine. Yes, please remember. आगे बढ़ते हैं. आगे बढ़ते हैं. आगे बढ़ते हैं. डायग्नोसिस. Okay. All of you are right. क्या बात है. Yes, all of you are right, my dear friends. Stage 2 fatty liver. We have to give them something that can prevent the fatty liver. These guys are called as lipotrophic factors. Remember, choline, betaine, lecithin. These are all lipotrophic factors, my dear friends, but not the arginine. Arginine is not. So question is except. All of the following are considered for beneficial in preventing the fatty liver except arginine. Arginine is not a lipotrophic factor, beta. Please remember over here, what are the lipotrophic factors? Lipotrophic factors, my dear friends, please try to understand. These guys can prevent the fatty liver disease because they take the TAG away from the liver. Remember, we have something called as those choline, betaine. Best guy is choline, then betaine, vitamin E, selenium. We have SAM, methionine, serine, glycine. We have got 3 vitamin 6, 9, 12. To some extent B5 as well. Ionositol and lecithin. And essential fatty acid and some PUFAs. Essential fatty acid and PUFAs are also there as lipotrophic factors. Please remember lipotrophic factors. Yes, please. Lipotrophic factors. Lipotrophic factors बेटा, यहाँ पर वो चीज जो नहीं है पूछा गया है. दैट्स व्हाई द आंसर विल गो फॉर आर्जिनिन इज नॉट देयर इन दिस लिस्ट. आगे बढ़ते हैं. प्लीज रिमेंबर. आगे बढ़ते हैं. ट्राई टू फोकस ऑन दिस बेटा. दिस इज ए क्वेश्चन दैट वी विल हैव टू ट्राई टू रिमेंबर ओवर हियर. क्वेश्चन नंबर 17 पे आते हैं. क्वेश्चन नंबर 17 जल्दी से देखते हैं. क्वेश्चन नंबर 17, डायग्नोसिस. क्वेश्चन नंबर 17, डायग्नोसिस बेटा. डायग्नोसिस कैसे करोगे? Question number 17. Yes, all of you are right, my dear friend. M spike in case of serum protein electrophoresis. After that, densitometry. In densitometry, we are able to see M spike, multiple myeloma, M spike. Remember, where we have overproduction of IgG. This is due to increased production of IgG. IgG is overproduced over here. Remember, my dear friends, the classical question we have got that painful urination, low back pain. Crab. What was the mnemonic? What was the mnemonic for multiple myeloma? Crab. Everybody knows crab. What is crab? Crab. Hypercalcemia. R say renal stones, which is causing painful urination. A say anemia, that is our normocytic normochromic anemia. And please remember, we are having bone pain, lytic bone lesion. B stands for bone pain, low back pain as well, my dear friends. Crab. Remember, CRAB. All of you are right. All of you are right, my dear. M spike only in multiple myeloma. M spike. Yes. Crab. All of you are right. Crab. CRAB. Right. Crab. This is the point that we have to remember. Hope this is crystal clear to all of you, but this is a case of multiple myeloma. However, there is a form which is called as MGUS, monoclonal gammopathy of undetermined significance. MGUS. This is not able to show you M spike. Monoclonal gammopathy of undetermined significance. It is a milder variety beta. It doesn't give you any M spike in case of this. Kappa lambda, we have studied about some test which was called as BJP. What is BJP, my dear friends? Yes, लोगों ने लिखा है Bence Jones proteins. क्या बात है? BJP is also positive. Bence Jones protein, it is also positive in case of multiple myeloma. BJP, Bence Jones protein. Question number 18. क्वेश्चन नंबर 18, जल्दी से क्वेश्चन नंबर 18. Answer to this question. Yes. No. Please remember. Try to look over here. Yes. Senile dementia. Yes. Frequent forgetfulness. Yes. You are right. Please try to understand. We have got two right answers over here. See, in this question, my dear friends, hyperphosphorylated tau protein is the right answer, as well as beta amyloid precursor protein is also a right answer. Both A and C are correct. But please remember, they have mainly mentioned about senile dementia over here. Senile dementia. Please remember, which of the following? In this case, I will choose the answer as C greater than A. Both are right answer. Both are right. This sort of question can come. We have to choose one best answer. We will go for C. C greater than A. Please remember, C greater than A is the answer in this question. C भी होगा beta amyloid precursor protein. This basically gets deposited in the hippocampus. We all know senile dementia actually is caused by that. And we have also hyperphosphorylated tau proteins that is causing memory loss because they will form NFTs, neurofibrillary tangles, right? We have discussed this. So important point, ध्यान देंगे बेटा, C greater than A. C greater than A. Question is unlikely. Sorry, I have missed. Unlikely. Answer is D. Sorry. My mistake. The answer is D. Sorry. I have missed. See, that's why we have to read the question properly. Anybody can make a mistake. That's why. Unlikely. Okay. Question was unlikely. Many people were answering A, C, B. Why? Question is unlikely. We know apoprotein E4 4 को उल्टा घुमा दो तो ये बन जाता है एल्जाइमर. ओके. Alzheimer. Okay, we did not pay attention. Alzheimer. It is also by E4. Okay, ये भी तो होता है. ABC, my dear friends, are seen in case of Alzheimer's disease. Hyperphosphorylated tau, apoprotein E4, beta amyloid precursor protein, which is also in short called as beta APP, amyloid precursor protein. Somebody of you has pointed it rightly, my dear friends. Please try to understand. Important point, the word is unlikely. देखो, never ever run behind directly. That's why try to watch out. I'm trying to give you different ways that you can avoid doing a mistake. Question देखा देखा unlikely है. It is not likely, unlikely. Now you are able to understand. Remember, free hit मिलेगा. Unlikely. That's why the answer of this question is lipoprotein A. रिमेंबर, लाइपोप्रोटीन ए ये कहां पर होता है वैसे? लाइपोप्रोटीन ए इट इज एसोसिएटेड मेनली विथ आथेरोस्क्लेरोसिस. याद करेंगे, वी हैव डिस्कस्ड, इट इज मेनली विथ आथेरोस्क्लेरोसिस. आथेरोस्क्लेरोसिस, प्लीज, इंपॉर्टेंट पॉइंट. दैट्स व्हाई एवरीबॉडी इज आंसरिंग ए बी सी. ऐसा क्यों? रीड, प्लीज read the question, read the question, read the question, read the question. Sincere request to you, my dear friends, please take at least 20 second 25 seconds times out of 1 minute to read the question, ताकि ऐसे वाले छोटे 2 लेटर मिस ना हो जाए. अनलाइकली पूछा था बेटा, अनलाइकली. You are all answering for along with me, you also answered, but we have all made a mistake. Remember, it should be answer D over here. Unlikely, unlikely. Yes, important point. Please important. Please remember, very very important point that we have to remember this. Associated in this said condition, unlikely पूछा है. Right, right. Somebody has hit the nail. Some of you were able to answer D. And one more thing, in the exam, my dear friends, never ever change your answer. Never ever change your answer. Many people have a bad habit. They will try to peek. Somebody else is doing something. Oh, you have marked it A, I marked it C. Oh, inferiority complex, he might be right. Maybe you are right. By looking at somebody else, you might be coming with a wrong answer. Never ever change your answer. Whatever the first thing is coming in your mind, try to stick with that same answer. Important, please remember this. Yes, yes, yes. ये इजी क्वेश्चन है, चॉकलेट क्वेश्चन है. मोस्ट लाइकली ज़ोंबी, ज़ोंबी हैज कम. सीजेडी, क्रूसफेल्ड जेकब डिजीज. प्लीज रिमेंबर, पर्सनालिटी चेंजेस, एंजाइटी, डिप्रेशन, मेमोरी लॉस. It is a case of prion disease. CJD, Creutzfeldt-Jakob disease. Creutzfeldt-Jakob, all of you are right. Alzheimer, Parkinson presentation is different that we have just now seen over there. Fatal familial insomnia, whole family will not be able to sleep at night. What they will do, it is their choice. Same joke one more time. Okay, आगे बढ़ते हैं, आगे बढ़ते हैं, आगे बढ़ते हैं, आगे बढ़ते हैं. Okay. Okay. Okay, zombie. Zombie has come. Okay. Answer, answer, answer. Answer, answer, answer. It is easy, 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 easy. Hello, कहाँ गए आप लोग? Where are you guys? Read the question. Okay, good that you guys are reading and then answering. Good. Answer, 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 my dear friends. Answer, my dear friends. Answer, my dear friends. कहाँ गए सबके सब? Where are you guys, my dear friends? Where are you? Where are you guys, my dear friends? Answer of this question, all of you, we can understand that the answer of this will be osteogenesis imperfecta. Osteogenesis imperfecta, my dear friends. Without any difficulty, we can all remember this osteogenesis imperfecta. Please remember, there is history of frequent fractures in his right lower limb. No active management was required, but on examination there was also a blue color sclera. This is definitely going for, my dear friends, our osteogenesis imperfecta. Remember, multiple fractures. Osteogenesis imperfecta को छोड़ के there is one more disorder where we can also see the homocystinuria. We can also see beta जी Homocystinuria, right? Homocystinuria. But apart from that, please try to understand it over here. Apart from this homocystinuria, mainly we have got fractures. That's why the answer is going for osteogenesis imperfecta. Osteogenesis imperfecta, right? Ehlers-Danlos syndrome, we have got this flexibility, stretchability of the skin and all those things, hypermobile joints, hyperextensible and hyperstretchable skin. Marfan syndrome feature is Marfan. All of you already know the mnemonic over there, right? Hope you are able to understand this. Coming to question number 21 over here. Coming to question number 21. Coming to question number 21. Hope all of you are there, beta. Yes. The answers are not coming. Hope you guys are all here. Suddenly you guys have stopped answering, beta. You all were answering nicely. Question number 21 in the chat section. Hope there is all okay. Hope this is all okay, beta. Hello. Just a moment. I hope all of you are there. Unable to see you guys. Your reply. Okay, just a moment. I'm unable to see your replies there, beta. Yes, all okay. Okay. Yeah, now the replies are again coming. I hope all of you are there, beta. Okay. So, yeah, this is a question. Yes, all of you are there. Thank God. Okay. There was some glitch, maybe it has got auto corrected. So, all of us can remember, beta. प्लीज रिमेंबर फ्यू डेज आफ्टर बर्थ रिफ्यूजेस ब्रेस्ट फीडिंग. देखा रिफ्यूजस से हम लोग याद करेंगे वॉमिट्स ड्यूरिंग फोर्स ब्रेस्ट फीडिंग, एक्सेप्टिंग प्लेन ग्लूकोज एंड वाटर. आंसर माय डियर फ्रेंड्स विल बी गोइंग फॉर गैलेक्टोसीमिया, है ना. इसमें कोई दो राह नहीं है बेटा. आई बिलीव ऑल ऑफ यू वुड हैव गॉट दिस वन आंसर करेक्ट. प्लीज रिमेंबर. ओके beta. Okay, great. All of you are able to understand. Yes, I missed some messages earlier. Let me just scroll. Yes, all of you have correct. All of you have come up with the right answer. All of you, sabhi ke sabhi, all of you have got this correct. Von Gogh disease presentation we have already seen. Hereditary fructose intolerance will be basically seen whenever we are giving fructose in our diet, है ना. We are giving only fructose in our diet. Hope this is crystal clear to all of you, beta. And remember, नो कन्फ्यूजन ओवर हियर. कमिंग टू दिस क्वेश्चन, जल्दी से इसको कर लेंगे. वी आर ऑलमोस्ट ऑन द लास्ट 3-4 क्वेश्चंस ऑफ आवर डिस्कशन. इसको देख लेंगे बेटा. आंसर essential fructosuria, we don't have to do much because most of the things will be not coming into the notice. Remember beta, aldolase B may there will be problems with insomnia to some extent, and there will be also some GI upset in hereditary fructose intolerance. That is how you try to differentiate between essential fructosuria versus hereditary fructose intolerance. Remember, insomnia is also quite common in case of fructose intolerance. Okay, all of you have answered. Remember, okay, all of you have come up with the answer. Alkaptonuria. Okay, I was busy explaining something. Anyhow, alkaptonuria, beta. All of you are right, beta. Alkaptonuria. Palmoplantar pigmentation, type of ochronosis, zone of calcification in the intervertebral disc, lumbosacral spine. Benedict test, it is giving positive greenish brown precipitate, because all of you know, my dear friends, that homogentisic acid is a reducing substance. Homogentisic acid, it is a reducing substance. That's why it can also give you the Benedict test positive. Remember, this is the thing that you can also get to see, cola color that you are able to see. In this case, actually they have done a Benedict test which is giving you this greenish brownish type of precipitate. बेटा ये वो कोला कलर वाला चीज नहीं है. Actually this is an image of the Benedict test. इसको एक बार ध्यान देंगे. You should not miss this बेटा. Benedict test perform करेंगे. Usually we have colors like green, orange, red. राइट, बट इन दिस केस इट इज गिविंग यू ग्रीनिश ब्राउन, ग्रीनिश एंड ब्राउनिश ऑरेंजिश थोड़ा सा मिक्स होके ना ऐसा कलर हो जाता है. दैट्स वाई दिस इज ऑल्सो फॉर होमोजेनेटिक एसिड बेनेडिक्ट टेस्ट. ये वो ऑन स्टैंडिंग कलर चेंज नहीं है, ऑल्दो इट इज लुकिंग लाइक दैट. एनी हाउ यू हैव डन द डायग्नोसिस करेक्ट, बट ये जो इमेज हम लोगों ने दिया है ना, दिस इज एक्चुअली फॉर द बेनेडिक्ट टेस्ट बेटा. ये बेनेडिक्ट टेस्ट वाला इमेज है, but in this case it is not the green, orange or red, it is giving you that greenish brownish type of color. ऐसे वाले इमेज भी आ सकते हैं. yes, ये एक्चुअली वो कोला कलर नहीं है. हाँ, इसको ध्यान देना है बेटा. ये कोला कलर जैसा दिख रहा है बोल के तो आप बच गए, बट एक्चुअली इट इज एन इमेज ऑफ बेनेडिक्ट टेस्ट बेटा. ओके, एनी हाउ द आंसर इज करेक्ट. आंसर इज करेक्ट, एल्काप्टोन्यूरिया. एल्काप्टोन्यूरिया. रिमेंबर, एनी हाउ यू हैव गॉट दिस वन करेक्ट. By hook or by crook, we have to make this answer correct in the upcoming exam. All of you will be able to do so. All of you remember beta ji, no confusion over here. Intervertebral disc zone of calcification, pinna of ear turning black. Remember, sometimes it can be this much black. Arey baap re baap re baap, too much black color. And this is the image of the palmoplantar pigmentation, where basically with central sparing on the edges there can be palmoplantar pigmentation. Palmoplantar pigmentation can be also remembered over here, right beta ji? Hope there is no confusion in this. Palmoplantar pigmentation. Palmoplantar pigmentation. Now what is this question? Another last three questions. Last three questions beta solve करेंगे. We'll solve this question जल्दी से. इजी है. इतना बड़ा बड़ा वर्ड देख के पैनिक होने का कोई जरूरत नहीं है. देयर इज नो नीड टू पैनिक. दीज आर इजी क्वेश्चंस बेटा, चॉकलेट क्वेश्चंस. आंसर 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 आंसर. अरे आंसर कहाँ गए सबके सब फिर से? ओके, वेयर आर यू गाइस? Yes, my dear friends, now you guys are coming out with right answer. There is a delay while the answer is reaching us. Remember, B, yes, biopterin. Yes, we all know that in the conversion of phenylalanine to tyrosine, we require some coenzyme that is called as biopterin. Remember over here, what is the confusing statement over here, beta ji? That phenylalanine level is high and it is a case of PKU. This is a case of PKU only. PKU ही है. But remember, during that test, we are seeing that the phenylalanine hydroxylase enzyme activity is normal. That means classical PKU ये नहीं है. This is a case of what type of PKU? Classical or non-classical? Hello. What is this diagnosis? Classical PKU or non-classical PKU? It is a case of non-classical PKU beta, where there is a problem with that coenzyme regeneration. Non-classical. Okay, this is a case of non-classical PKU, my dear friends. Non-classical PKU है ये. एंड याद करेंगे बेटा जी, इंपॉर्टेंट पॉइंट टू बी नोटेड, सम टाइम द फिनाइल कीटोन्यूरिया माइट बी ड्यू टू द कोएंजाइम डिफेक्ट, दैट इज बायोप्टेरिन. कोएंजाइम डिफेक्ट के कारण भी ये सब चीज हो सकता है. ट्राई टू रिमेंबर दिस पॉइंट. वेरी 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 इंपॉर्टेंट पॉइंट टू बी नोटेड बेटा. Don't try to blame only the enzyme. It is a case of non-classical PKU, and try to remember focusing it over here. Phenylalanine to tyrosine. Everybody knows phenylalanine hydroxylase. Here this enzyme is okay, no problem. But remember that another enzyme, dihydrobiopterin to tetrahydrobiopterin, by this dihydrobiopterin reductase, if this enzyme is problematic, then also it will be creating problem. That's why we are going for exogenous this biopterin supplementation from the outside. That's why biopterin is important. What is the question they have asked? That a possible explanation for this finding is a deficiency of the function of which of the following coenzyme. It is biopterin, that is the coenzyme for our phenylalanine to tyrosine conversion. अगर ये चीज में प्रॉब्लम हुआ तब भी हो सकता है नॉन क्लासिकल PKU, राइट? होप दिस इज क्लियर टू ऑल ऑफ यू बेटा. नॉन क्लासिकल PKU, नॉन क्लासिकल. ओके, great. Chocolate question. We're almost at the end. That's why chocolate question. इसका आंसर दे दो खुशी खुशी with a smiling face. If you get this, again mark it right, my dear friends. Hope there is no confusion in this, right? इसका आंसर दे दो, आंसर दे दो. All of you will be right. I'm sure all of you will be right. Answer, answer. Without any doubt, all of you are right. The diagnosis is for Ehlers-Danlos syndrome. चॉकलेट क्वेश्चन, ऐसे क्वेश्चन आए तो मजा आ जाएगा भाई, मजा आएगा. आंसर सही होंगे. रिमेंबर, Ehlers-Danlos syndrome. Osteogenesis imperfecta में we have got bone problem, fractures of bone, kyphoscoliosis, then we have bowing of legs, deformed teeth formation, all those. Ehlers-Danlos syndrome, hyperstretchability of the skin and flexible fingers. My dear friends, please remember, without any difficulty, all of you have got this correct. All of you have got this one correct. Chondrodysplasia, rare disorder, baby is born without cartilage. Marfan syndrome, mnemonic is Marfan, which you guys already know. Rubber man syndrome, yes, Ehlers-Danlos syndrome is also called as rubber man syndrome. We have also discussed this earlier. Rubber man syndrome, है ना? Rubber man syndrome, right? No confusion. Coming to the last question of our session, please make this one correct. Try to read it carefully. Do not make any mistake and come up with the right answer. आंसर, आंसर, आंसर. इसका आंसर देंगे बेटा. थोड़ा सा टाइम लेके दो ना, थोड़ा सा. लास्ट क्वेश्चन है, वाई टू रश? लास्ट क्वेश्चन है, आराम से पढ़ो ना थोड़ा सा. वाई टू रश? वाई यू आर रशिंग बेटा? आराम से पढ़ो ना. वाई टू गो फॉर दिस? दोबारा देखो, दोबारा. नो, अरे बेटा थोड़ा सा पढ़ो ना, थोड़ा सा पढ़ो, थोड़ा सा पढ़ो, थोड़ा सा पढ़ो, थोड़ा सा तो पढ़ो, थोड़ा सा. नहीं रे, पढ़ो पढ़ो. यस, somebody is coming up with the right answer in between. देखो इसमें क्या क्वेश्चन है. नो 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 बेटा, यू. ये देखो, ये देखो, लेट मी हेल्प यू. फर्स्ट ऑफ ऑल, व्हाट इज द डायग्नोसिस? ये सब छोड़ो. ओके, नो नो नो, यू गाइस आर नॉट गिविंग द राइट आंसर. व्हाट इज द डायग्नोसिस ऑफ दिस केस? डायग्नोसिस क्या है? व्हाट इज द डायग्नोसिस? प्लीज रिमेंबर, व्हाट इज द डायग्नोसिस? डायग्नोसिस ये सब छोड़ो. डोंट लुक एट द ऑप्शन. Don't look at the option. What is the diagnosis of this case? 65-year-old man, coronary artery disease, follow up, 6 feet tall, 6 feet tall, 6 feet tall. लंबा इंसान है, लंबा इंसान. वेट ओके, बीएमआई ओके, ब्लड प्रेशर ओके, लंग्स आर ओके, नो पॉइंट ऑफ मैक्सिमल इल्सस ओके, ग्लूकोज कंसेंट्रेशन 95, homocysteine is high. What is this? Yes, my dear friend, the diagnosis is homocysteinuria. First do the diagnosis. Homocysteinuria. Lipid is also okay. Which of the following amino acid is most likely to be decreased in this patient? Remember, my dear friends, we have studied that during homocysteinuria, either there is a problem to go towards cysteine, or there is a problem to come back to methionine. Homocysteine to methionine conversion, my dear friends, if it is not done, then which amino acid will become gradually low? Please remember, it is methionine is the answer beta. देखो, ध्यान देना था, ध्यान देना था ना, इसीलिए methionine. It is methionine most likely to be decreased in a patient of homocysteinuria. Why methionine beta ji? Look over here. We have studied that during homocysteine metabolism, homocysteine can be converted by CBS to form cystathionine that can finally go for cysteine, right? This is the normal route, CBS, rate limiting enzyme. However, we have a backup route by which homocysteine can be also converted to methionine. There was an enzyme called as methionine synthase, and during this reconversion, all of you guys remember, we had needed two important vitamin over here. What are the two important vitamin? B9 and B12. B9 and B12 is required over here. In CBS reactions, What do you require? You require B6, which is also required for CGL. Again B6. Remember that pathway which we have seen in our workbook. बायोकेम वर्कबुक में ये था ना, ये पाथवे हम लोगों ने डिस्कस किया था. होमोसिस्टीन आइदर कैन गो फॉर प्रोडक्शन टू सिस्टीन और इट कैन गो बैक टू फॉर्म मिथियोनिन. So if there is homocystinuria, what will happen? There will be either failure of this or failure of this. So either cysteine will be low or methionine will be low in this patient. That's why homocysteine is going to shoot up over here. Please remember this. So that's why there is a problem in the methionine regeneration. Yes, B9 and B12. Remember methionine regeneration. Beta, hope all of you can relate to this and remember this beta, and without any difficulty plan also can answer the questions correctly beta. So ये एक homocystinuria का केस था. यहाँ पर cysteine अगर ऑप्शन में होता, you could have also marked as cysteine. Methionine के साथ साथ you can remember one more amino acid that can be also decreased over here, that is cysteine. दोनों में से कोई एक आंसर हो सकता है. There is also way to differentiate. We have to also check for the level of the vitamins. If there is a problem with B6, then cysteine production will go down. If there is a problem with B9 or B12, methionine regeneration will be going down. Remember, B6 है तो ये वाला चीज नहीं बन पाएगा, B9 B12 नहीं है तो methionine regeneration will be stopped, right? That's why either of these two can be asked as an answer. Cysteine is not there in the option. That's why the correct answer of this is methionine. That was everything from my side, my dear friends. The 25 most important clinical type questions that might be appearing from biochemistry on the 6th of July of FMG exam. And I hope that all of you can keep your calm. Look at the question paper, look at the computer screen, don't panic, read the question correctly, read the last line first. If it can be solved like that, you solve it then and there, save time. If not, you try to read the complete question and try to go for positive findings. ऐसे जो clinical type questions होंगे ना बेटा, you try to go for positive findings which is going to favor your diagnosis. This is only the mantra from my side. I sincerely pray to God from the core of my heart that all of you, my dear friends, can come out with flying colors. Wishing you guys all the very best, and I sincerely pray to God that may every one of you pass. Doesn't matter from which medical college you have passed, doesn't matter from which country you have graduated, it will all boils down to only one fact, that whether you are able to see your bright future ahead of you or not. There is only one checkpoint that is waiting for you to cross, my dear friend. That is the FMG exam on 6th of July. You will be able to cross that checkpoint. You will be able to go forward and further, and you will be able to succeed in my life, in your life, my dear friends. Think about where you are going and never mind where you have been. जो बीत गया उसको भूल जाओ, जहां पर हो उसके बारे में सोचो. This is the moment. You are just at the corner from changing your status from an FMG to an IMG. FMG to an IMG will be happening on 6th of July, my dear friends. Keep your calm and keep focus. Keep your morale very high. You are at the last stretches of your preparation. Revise, re-revise, and re-revise, my dear friend. Lots of best wishes from the core of my heart, my dear friend. Thank you so much for coming online, and a big thumbs up to all of you, that all of you will be coming out with flying colors. Thank you so much. It will happen in July itself, my dear friends. Just keep believing in yourself, keep faith in the Almighty, and success will be yours. Definitely. Thank you all. Signing off, and good night to all of you. Thank you so much, brother. Thank you so much.